H.R. 3127, Medicare Home Health Flexibility Act. This bill has recently been introduced to the House of Representatives. If it is able to pass through the House of Representatives, the Senate, and the President, it has the potential to become a federal law. Introduced and sponsored by Democrat Lloyd Doggett, he has gained the support of 16 co-sponsors. These co-sponsors have demonstrated bipartisan support from both the Republican and Democratic political parties. This image represents all of the current co-sponsors for H.R. 3127. There are 9 Republican co-sponsors and 8 Democrat co-sponsors. H.R. 3127 intends to decrease the amount of time that patients will have to wait before receiving home occupational therapy services. This bill hopes to establish circumstances where occupational therapists may conduct initial assessments for individuals who are eligible for home health services under Medicare. This is specific to cases in which the physician's referral order excludes skilled nursing but includes occupational therapy and physical therapy or speech-language pathology. Currently, occupational therapists must wait for these disciplines to initiate and perform the comprehensive assessments before they are allowed to start their own plan of care. H.R. 3127 was introduced and referred to the House of Representatives, the Committee on Ways and Means, and the Committee on Energy and Commerce on June 5, 2019. There is currently also a same-as bill, S1725, that represents all of the same points. It was introduced to the Committee on Finance by Benjamin Cardin on June 5, 2019. However, it has yet to be introduced to the Senate. Other versions of this bill that were introduced in previous years and why they were not passed can be found in the chart below. Formal actors are known as those who have the power to directly approve and carry out the policies. The formal actors within the United States Congress for H.R. 3127 include the House of Representatives, the Senate, and President Donald Trump. The Committee of Ways and Means, represented by Richard Neal, and the Committee of Energy and Commerce, represented by Frank Pallone, are also considered formal actors within this process because they provide influential opinions and act on this bill. An association that is directly involved with this bill is the Center for Medicare and Medicaid Services. Informal actors do not hold any legal power, but with their involvement and support, they can help promote and spread awareness of the issue. Associations that are informally involved include the American Occupational Therapy Association, the National Association for Home Care and Hospice, the American Physical Therapy Association, and the American Speech-Language Hearing Association. On a professional level, OTs, PTs, and speech-language pathologists, along with home care providers, all play a role. On a local level, home care recipients are also known as informal actors. H.R. 3127 was analyzed using the Rational Comprehensive Decision-Making Model. This is a model of decision-making in which it is assumed that decision-makers have nearly all information about a problem, its causes, and its solutions at their disposal, whereupon a large number of alternatives can be weighted and the best one selected. There are many possible solutions to address this healthcare problem. However, many factors were weighed and considered before determining a final solution. Based on years of gathering more information, this bill has been revised to an appropriate level that has clarified all previous criticisms to make it the best possible solution. Goal consensus and information processing demands are 2 identifiable obstacles to the chosen model. With the identified problem, it can be difficult to understand what specific goals a policy may encompass. Many bills are proposed with ambiguous goals in hopes to gain legislative passage, leaving the formal actors to determine the most important goals for the bill. Under the information processing demands, it is nearly impossible to gather all of the information about this particular issue. This makes it difficult for decision makers to gather all of the information, weigh the various options, and make an informed decision. To address the stated obstacles, this bill has identified clear goals that have been presented to many committees that pertain to developing the specifics of this bill. Stating clear goals has left little room for alterations that could stray away from the original purpose. H.R. 3127 has been introduced to the Committee of Ways and Means, the Committee of Energy and Commerce, and previously to the Committee on Finance and the Congressional Budget Office. This strategy has gathered the most information to be analyzed about the problem. There are many external forces that act on the development of this policy. Socially, not many people understand the role of occupational therapists within the home care setting. This leaves those who are unaware of the current issues to more strongly advocate due to the lack of knowledge within the general public. Politically, this bill is not considered a front-burner issue that is being addressed. One political aspect that limits the development of this bill is that there is not nearly enough publicity about the specific issue. There is also a lack of education about occupational therapy and its role within the home. Economically, this bill is identified as a zero-cost bill. This is viewed highly among those interested in supporting the bill. With no cost, it means that there will be no increase in taxes and that very few changes will need to be made for reimbursement. Professionally, many occupational therapists, physical therapists, and speech-language pathologists support this bill. However, there are a handful of occupational therapists that oppose the idea of increased paperwork. Some aspects to consider would be opposition to changes from occupational therapists, support from other disciplines, the cost-benefit analysis, and the nature of the information itself. Due to occupational therapists not being able to complete the initial comprehensive assessments, there are increasing delays in providing home care services. It is commonly questioned why an occupational therapist is able to close a patient and not open one. These unnecessary barriers directly influence the quality, timeliness, and appropriateness of the care provided. In cases where other disciplines are limited, delays for services can be extensive. This prevents occupational therapists from implementing skilled services for us. Passing H.R. 3127 would completely redefine what occupational therapists do in a home health setting. The imbalance among skilled therapy services would be addressed and provide appropriate credit to each respective discipline, including occupational therapy. Here are some thoughts from those who would be affected if this bill were to be passed.
Waiting is so hard, especially the older you get, you want instant gratification, especially in taking a shower or going to the bathroom. So
I feel it's very important that people maintain their quality of life, that they can continue to do things that they would normally do.
I was in the hospital and I couldn't wait to get home to have a shower. I needed help. I wanted to know that I could do things on my own.
Because I would want to shower and do all the things that I normally do.
When I got home, I didn't need a nurse. I didn't need physical therapy, but I did need an occupational therapist to teach me how to get dressed, to get in and out of bed, to get up and down without using my arms.
The issue was that I had to give my mother-in-law a shower on a regular basis, which I think it was a good 2 to 3 weeks before we got someone to help.
For an elderly couple, one of whom may be the post-hospital person, and the other one who has their own issues in terms of being a caregiver, it's so important to get someone there soon to the door to look at the needs in the home.
When these people do not have OT right up front, it makes it very difficult. They get more depressed. It's more hard to get them engaged in life again. And I think it's very important for OTs to be able to start the case early.
I am in favor of the passing of H.R. Bill 3127, which allows OT to come into the homes of people recently released from the hospital.
Occupational therapy has so many of the practical answers and the bright ideas in terms of looking at the home and seeing what needs to be done to make it livable and possible for that person to be at home and for the caregiver to cope as well.
It's better to have it sooner than later.
but it's your choice.
I would probably be okay to wait like 1 day.
If it was me, I wouldn't want to wait more than a few hours for the first one to show up, especially if it was my shower day.
I would be willing to wait at least a day or a day and a half maybe for occupational therapy, but I would definitely want it within that time frame.
I feel if this is not done for these patients, that they would not recover as quickly as they could.
I remember waiting to get to the occupational therapist after I get out of rehab. So it's definitely a necessity.
There's no reason it could not be the occupational therapist.
I would hope that the representatives would vote for it.
To further show support for this bill, you can send a letter to your county representative by visiting the first link and sign a petition from change.org at the second link. Thank you.